Hi, I'm Lulu and a clinical specialist women's health physiotherapist. In this video, I'm going to explain about the anatomy of the pelvic floor and help you understand how the pelvic floor works, what its functions are, what happens when it goes wrong and the muscles are weak, which we call dysfunction, and most importantly, how to help you stop these conditions occurring. So let's begin by understanding a little bit about the pelvic floor. Where is the pelvic floor and what's its anatomy? These muscles are a group of muscles that form together a bowl, and they begin by their attachment at the front of the pelvis and make their way backwards in a sling shape bowl and attach mainly to the coccyx, your tailbone. This muscles, or this group of muscles, sit directly under three pelvic organs. They are the bladder at the front of the pelvis, the uterus, or your womb, that sits in the middle, and the rectum that sits at the back, at the rear. Now, these pelvic floor muscles have three openings in a woman. They are the front passage, which is the opening of the bladder, which comes through the urethra, and it's where the urine exits from the body, from the bladder. The middle opening, which is the vaginal opening, which is the where the uterus or the womb goes through the cervix and then through into the vagina, and this is where things will go in and out. That is your baby when it was born. And there is the back passage, which is the rectum, and that has the opening called the anus, which is where our stools or bowels open from. What is the function then of the pelvic floor? Well, the first function we mentioned is because these muscles are sitting underneath the pelvic organs, and therefore their main function is that of support. They hold up the pelvic organs against the direction of gravity that's bearing down on them. Secondly, a very important function is that of closure, because part of the pelvic muscles form a ring or a sphincter, and they are around the back passage, which is, as we say, where your stools pass, your feces or stools pass. And so when they are contracted or squeezed closed, they help control the involuntary escape of wind, so that you don't pass wind at an awkward moment, and also the involuntary escape of your stool, your poo, because we sometimes need to hold on even when you get the urge to do a poo and go into a convenient time and a convenient place. Next, there is the sphincter at the front, which is at the opening from the bladder. And so part of that control is then the control of urine and helps with the involuntary loss of urine. So not only do these muscles have to constrict and close, but they also need to release and open and let these body fluids and body matter pass. And also they need to release to allow you to give birth. And finally, a very important function is that of sexual function. So it's related to tone, or the strength of the vagina, and also to related to orgasm. And therefore, it's another important reason to get your pelvic floor muscles working well after the birth of your baby. So when things go wrong and we have dysfunction and there's weakness in the muscle, it can cause a descent or a dropping down of these three pelvic organs that I've mentioned before. That of the bladder, which we will call a cystocele, that of the uterus or womb, which is the vaginal descent, and that of the back passage, which can then be caused a rectocele. So any of these three organs can descend or prolapse down through the vagina, and we definitely want to avoid that happening if that's possible. And of course, the next thing that can happen when things go wrong is the leakage of urine and the leakage of poo and the leakage of wind. And again, we don't want that to happen if we can avoid it. And of course, there is another dysfunction, which is that of constipation, which is when you need to strain to have your bowels open because the in those circumstances where the anal sphincter isn't relaxed and open as you're opening your bowels. So that can lead to constipation and straining. And also there can be what's called dyspareunia, which is painful intercourse. So what are the causes of pelvic floor dysfunction and pelvic floor muscle weakness? Well, the first, unfortunately, we can't do anything about, which is your biological DNA, and that comes from your biological mother and father. There's nothing that we can do to change it, but the DNA that you inherit can affect the supporting structure of the collagen. But as I say, unfortunately, we can't do anything about that. And then there's pregnancy itself and childbirth. So the pregnancy is the weight of carrying that baby over those several months that you're carrying your baby at an added weight to your pelvic floor muscles. And also a vaginal delivery stretches your pelvic floor muscles. The type of delivery can have an impact and effect on your pelvic floor muscles and increase your risk to any of those conditions that I've just mentioned to you. And this could be an assisted delivery, such as a kiwi or a ventouse, or which are vacuum suction, or it can be a forceps delivery. So these assisted deliveries just increase a little bit more your risk of pelvic floor dysfunction, as does the weight of your baby. So the larger your baby, the heavier the baby. And we usually say babies that are over about 4 kilos carry a little bit more of a risk. The type of delivery, so a very long second stage, a very long stage of pushing, can have an effect and weaken your pelvic floor muscles a little bit more. But so can a very fast and a very rapid second stage, where the muscles haven't had time to relax and to slowly open out. So that can really increase your vulnerability to sustain a tear. And when you have a tear that's a 3rd degree or a 4th degree tear, then these are this is another reason that can increase your risk and vulnerability to pelvic floor dysfunction. Of course, carrying more than one baby at a time, so if you're having twins or triplets, will increase the weight you're carrying and also increase that risk factor, just puts you up the scale a little bit more, as do multiple births. So the more children you have and the more vaginal deliveries you have, the greater your risk. However, that shouldn't affect your family planning. Please go ahead and have as many babies as you would like to have, but it does mean that you need to work harder on your pelvic floor muscle strengthening. So what are the things that we can't also help that has an effect on our pelvic floor? Would be gravity, because gravity is constantly bearing down on this pelvic floor down below and constantly having a downward pressure. So the longer that we live, the older we get, the more time that we've been vulnerable to this pressure. And therefore, aging is a natural cause of decline in pelvic floor strength. And we can set that right by doing pelvic floor strengthening exercises throughout our life, certainly from childbirth onwards. And the other thing that happens as you get older in women is the menopause, and this causes a natural decline in estrogen levels, and that in itself can reduce the supporting structures. The additional supporting structures don't function as well, such as the fascia and the ligaments that help with the muscles with support. And so as that function declines, so muscle floor weakness will become more obvious as you get older after menopause. Other things that can have an effect are obesity. So the more weight that you are carrying, the more weight your pelvic floor is having to carry, and therefore the harder it is for your muscles to hold up and support. So the more your muscle, your body mass index and your weight is normal weight, the better it is for your pelvic floor. Another thing that can cause pelvic floor weakness is constant straining to have your bowels open. So chronic constipation causes a constant downward pressure if that's a really chronic problem, and it's best to try and avoid that, as does chronic cough. So if you have uncontrolled asthma or for example a cough from an allergy, please see your GP about looking at ways to control a cough better, because this again will be weakening your pelvic floor muscles. And finally, one of the things that's very important to address is inappropriate exercise and sport. So anything that increases the pressure inside our tummy, that's called intra-abdominal pressure, actually increases the downward weight or the downward stresses onto our pelvic floor. So that's such things as coughing, sneezing, lifting, running, jumping, as in Zumba classes, as in kickboxing, as in high impact or high intensity training due to the ground forces. This again can be a lot of strain on our pelvic floor, and we should only really exercise and give our pelvic floor as much loading as the muscles are strong and can resist that load. So what else is important is something called the knack. You may have read or heard about this, and the knack is the name given to squeezing your pelvic floor muscles and contracting them during any activity that causes that increase in pressure and a downward force, such as a cough or sneeze. So it's not just strengthening the muscles and building up their strength and endurance, it's also about using them at the right time. So it's very important to squeeze your pelvic floor with a cough or sneeze or lift. So what is it about pelvic floor muscle strengthenings? What are the principles of strengthening these muscles? Well, it's the same as any other muscle in your body. So if you're going to the gym to build up your biceps muscles, you are all individuals. So not everybody can pick the same weight and lift 2 kilos or 5 kilos or 10 kilos, everybody according to their own strength. And that's the same with your pelvic floor muscles. You need to individualize them to your own ability. But there are ways that we can increase the or progress the exercises, and that's by increasing the length of our hold of a pelvic floor squeeze. So that's your endurance, how long you hold it for. There's increasing the number of repetitions, how many times you repeat in any single session, the number of squeezes that you perform. There is decreasing the rest intervals, so how long you rest between each successive squeeze. The shorter that is, the harder it is. And then there's positions. Choosing lying down is the easiest way to exercise your pelvic floor muscles because you counterbalance the effect of gravity. There's no loading in this plane. And then there's sitting and standing and kneeling, which are very important that you progress your pelvic floor muscle exercises to include these functional positions. So how long should you be exercising for? Well, evidence shows us that you need to exercise around 4 to 6 times a day for 4 to 6 months in order to bring your pelvic floor muscles up to their maximum potential, or to return them to this maximum potential. So if you exercise less than that, it may take you a little longer to reach that stage. And if you really exercise just randomly every now and then, you probably will never reach your maximum. So it does require dedication to return your muscles back to their best level. And of course, any strength that you gain, just like stopping going to the gym to work your biceps muscle that we spoke about, will also reverse any gain of strength and endurance that you found. So these actually are lifelong exercises. So I would always say it's a bit like brushing your teeth. I'm sure and hope that most of you listening to this video will all brush your teeth without having a reminder, probably twice a day. And we do that to prevent tooth decay and gum disease later in life. And in the same way, pelvic floor muscle exercises are really there as a prevention, we hope, for preventing pelvic floor prolapse of the pelvic organs and the pelvic floor dysfunction, such as involuntary leakage of urine or wind or stools or poo. Okay, So it's very important to make it part of your everyday routine. So after you finish doing your 4 to 6 months of intense pelvic floor training, what's a good association is to have that after finishing brushing your teeth, you just remain in standing those extra couple of minutes twice a day and do your pelvic floor exercises. And then you're really probably set for life, which is good. So some of you listening may wonder whether it's necessary for you to be doing pelvic floor exercises because you have no symptoms. Well, in the first 2 or 3 decades after childbirth, you are able to compensate for any muscle floor weakness because of the other supporting tissues that are there, the ligaments, the end of floor pelvic fascia. So these will help offer support. But once that support declines because of, as we previously spoke about, the decrease in your estrogen levels, then this pelvic floor muscle weakness or damage will manifest itself and become obvious. So yes, everybody would be helped by doing regular daily pelvic floor strengthening exercises. So how do we exercise? Well, it may be a little bit boring. However, there is only one way to exercise your pelvic floor muscles, and that is by doing pelvic floor muscle strengthening exercises in isolation. So that's without your core exercises of Pilates and other exercises, which are very good in their own right, but not specifically targeting pelvic floor muscle on their own in isolation. So in a moment we're going to try some exercises together, but a little bit more about the theory. There are 2 types of muscle fibers in any skeletal muscle. One is for endurance. That's how long you can hold that contraction for. And those are targeted or performed by your slow muscle. You may hear about this if you read about this on the internet. Your slow or type 1 endurance fibers. But you need both that and your strength muscles, which are your fast twitch, your type 2 muscle fibers. So when you squeeze your pelvic floor, the feeling you're going to get because of this pelvic floor anatomy of this bowl shape is the feeling of squeezing close together and a lifting slightly forward, slightly upwards and forwards from the back passage through to the front passage. So it's a little bit like a lift going up in a building. And when a lift goes up in a building, the building itself, of course, doesn't move. So if I'm squeezing my pelvic floor muscles now, you shouldn't see me lifting. If I'm using the wrong muscles, like my buttock muscles, you will see me slowly lifting off the chair. So you can exercise in front of a mirror and check that you are not using any of these extra muscles. There are lots of different analogies you can think of when you're doing these exercises. It's a very subtle movement. It's not a very powerful movement. So I like to think about it sometimes as holding a very fragile glass test tube in the vagina that you're just wanting to squeeze and lift. Just hold and lift gently upwards. So the feeling is as if you're stopping yourself passing wind and then bringing it forward to the front passage as if you're stopping yourself doing a wee. Some people respond more to one cue and some to another. But what's very important here to stress is never ever stop your urine mid-flow. Yes, this uses the pelvic floor muscles if you do slow down or stop the stream. However, it can cause backflow or reflux into the kidney and cause infection and be very damaging to the normal mechanism. So please don't do that. You can also have a look. Visualization is good. Get to know your vagina. Have a look and see if you can see a pelvic floor muscle contraction. And this is best done in lying where your back is supported and your head is supported and you're not straining to look at the pelvic floor muscles. So place a mirror between your legs as you are lying on the bed, but make sure your back and your head are well supported by pillows. Okay? That's one way, or even with a clean finger, you can place that inside the vagina and feel your muscles closing. If you feel any bearing down, then stop doing your pelvic floor exercises. Okay, so let's have a think about the actual pelvic floor muscle contraction and maybe do some together with me now. So the first thing you want to do is to squeeze and hold. Gently squeeze through the back passage, making sure you're not using your buttock muscles, pulling in your tummy hard, or taking a breath in and then release. You may like to sit with your palms underneath your buttock muscles and to make sure that you're not squeezing your buttocks, as I showed you before. If you're squeezing your buttocks, you'll feel a tightening under your hand and also a slight raising of your body. Make sure you're not doing that. To feel the muscle contraction a little bit harder, you can try and time that with a very gentle exhalation. So you're gently breathing out as you squeeze and then release. And because your diaphragm is lifting, your pelvic floors can recruit and engage much stronger. And the next progression is to do those two things together and then to count out loud to make sure and to ensure you are not holding your breath. So we're going to count towards 10 seconds. So it's a gentle exhalation and squeeze and holding it, counting 1, 2, 3, 4, 5, and towards 10. And as soon as you feel that pelvic floor muscle release, that is your personal maximum for your endurance. And that's what you need to repeat each session, up to 10 repetitions. And finally, there's the fast squeeze exercise, which is a squeeze and hold for 1 to 2 seconds and an immediate release. So it's quite rapid. Squeeze, let go. 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 And you can repeat that up to 10 or 20 times in one session. So there we have it. There are your pelvic floor exercises. And one of the things that often happens is actually forgetting them and forgetting to do them. So some little reminder tips are, as you have your new baby, try to associate that with feeding your baby perhaps 6 to 8 times a day. So that's a good time to do your pelvic floor exercises. Today we have phone alarms. You can set alarms on your smartphones. Perhaps just put post-it notes around the house somewhere. Keep a chart, keep an Excel spreadsheet. And most importantly, you can exercise, for example, at every red light. You can do your fast twitch. I don't advocate and may not advocate you driving and doing contraction at the same time. But try to find an association, something that you do daily that will help remind you to do your pelvic floor exercises. So best of luck and keep going. And remember, this is for life. Thank you.